Okay, so let's see what this means. It's our weekly update now on Arizona hospitals, how they're dealing with COVID-19. We have Dr. Ross Goldberg in, always a wealth of knowledge. Dr. Goldberg, great seeing you. President of the Arizona Medical Association, District Medical Group Vice Chair of Surgery at Valleywise Health. So, Dr. Goldberg, so what do you think about this? We're seeing a little bit of an uptick. Are you seeing that in the hospitals?
First, good morning. Always a pleasure. Our hospital, we're kind of maintaining, but yeah, we're seeing overall a slight increase. It's something to watch out for and keep an eye on.
So tell me about, when you say slight increase, it can't be anywhere near where we were 3 or 4 months ago, right? So we're not even, are we close to crisis type levels, or is this just something, I don't want to say bothering you, but is it something that's impacting your day-to-day at the hospital at this point?
Not a direct impact on a day-to-day, but again, you look at what happened in Europe, you look what's going on in the other parts of the country, there's reason to be concerned. You don't want to have another spike. So I don't want us to get to those numbers we were earlier this summer. So being aware of it and keeping a close eye and being reactive to the numbers now is really important.
So here we are in October, and flu season, I'm sure, is flu season underway? Would you say that? Are you starting to see flu cases in there?
I personally haven't seen flu cases, but I have gotten my flu shot already. So yes, I would say flu season's well underway.
So what kind of preps are you making now for the combo of COVID and flu heading into the late fall here?
Well, we've always been ready for a surge because we were never sure if it was going to come back with the coronavirus and when. Nicely, the requirements you need to do to control the flu and COVID are really the same, right? You need to wear your mask, social distance, wash your hands. So we're ready with PPE. We're prepared. We're just hoping that as everyone pays attention and follows the rules, gets your flu shot, we can keep things to a controlled number.
So the president, and I don't want to get political here at all, but the president, 74-year-old man, obviously, or reportedly has some pre-existing conditions. Your thoughts on how the president is handling and his doctors are handling his COVID diagnosis? Are you surprised with how well he's doing, if he's doing as well, or what are your thoughts overall?
Well, obviously, I hope he has a quick and speedy recovery. It's hard to really maintain because I know they don't want to share all the information. There is some privacy, and there's some overall, concern of not wanting to put too much information out there. So it's hard to say. He was on a cocktail of drugs that we don't normally use. So it's also hard to say which one of those may be having an effect. So we have to keep a close eye on him. I think they need to stay cautious with him, as well as everyone around him. As an older individual, he still has a risk for spreading it to other people still. So you want to be safe. Being cautious here is the right way to go, in my opinion.
You were talking about the drug cocktail, and I'm assuming now that he's being treated in a different way than you treat your patients there. Was there anything that he was getting that surprised you?
I'm surprised the experimental nature. Regeneron is interesting. There's very limited information that we have. And again, we haven't done the combination of the monoclonal antibodies with remdesivir and dexamethasone. And again, you're using them for different reasons. So it's hard to say which one has had the effect. So it's really to see how he does, but we still need to use the science to guide how we're going to treat people.
Dr. Goldberg, thank you for all you're doing, you and your entire staff there at all the hospitals, what you're doing in our community. I appreciate talking with you, and I hope to see you again next week. Thanks for being on.
Absolutely. Have a great day.
All right, take care. Celeste.